Good morning, family. Welcome back to our channel. Today's vlog takes you on a slightly different kind of journey. Not to Durban, not to Cape Town, not to Hartsmith or anywhere in South Africa, but to a quiet, polished clinic right here in Sandton, Johannesburg. My wife Monique had been feeling a mild but persistent discomfort in her right heel. Nothing dramatic, but after several long road trips across South Africa, the drives, the stop, the sightseeing, the pain began to surface more noticeably. Today, we decided to pay a visit to a podiatrist, Dr. Graig, a specialist in foot and ankle health, to understand what was really going on. In the morning, Dr. Graig invited us in. A calm, attentive gentleman. He began by taking a detailed medical history. When did the pain, start? Which part of the heel was affected? Did it worsen during specific movements like driving, walking barefoot, or climbing stairs? This step, he explained, was crucial to differentiating between conditions such as plantar fasciitis and calcaneal bursitis or Achilles tendinopathy, or common cause of heel pain, especially after repetitive strain or prolonged travel.
Attaches right there on the calcaneal bone, all right, just over there, and it runs all the way to the balls of our feet. Okay, as you can see, the most affected spot is usually underneath the heel, and sometimes as this progresses, okay, it will start going all the way into the arch area itself. So if you were walking for a long time, you might then start to feel it in that region, okay? But the reason why you're now feeling it in the morning, right, and not really during the day. So what happens when you are sleeping, this plantar fascia goes into a resting position, okay? So it goes into that rested position, so there's no tension anymore, right? So when you go to bed, you're not in any pain or anything of that sort, right? But so the whole night the foot remains in that rested position and it gets used to being in that position again. But then what happens when you first put your foot down in the morning? So you see, throughout the day what is happening is, in this area we build up a thing called substance P, right? Substance P, when it's released, it causes a pain stimulus, and it's usually found in areas where there's inflammation or things like that. So what happens is, when you now put your foot down in the morning, this plantar fascia stretches out instantly. It stretches, it pulls on the heel, and then it starts feeling like there's something sort of shooting and pressing in that area. But as you start to walk again, that plantar fascia starts to stretch out, it starts to ease, and the pain then starts to go us that anti-inflammatory effect as well. Okay, so we're gonna ice it, we're gonna rest, meaning no high impact activities. Okay, so no running, walking, or anything of that sort for now, up until we can get this sort of sorted and gone. Alright, because this is something that is chronic. It's not, it can be acute, but it can also be chronic. Okay, and what I mean by that is it can be acute, it can come for a few days, it'll go away, and then if you still continue with the shoes and the incorrect footwear, all that, it can come back again, and it can stick around for a very, very long time. We're talking about 6 months, 8 months, 12 months, just depending on how you treat it and what you actually do, because you can see why it's happening, right? So if you continue to let that happen, it just sticks around. Okay, so then the next thing we're going to do is we're going to try and strengthen the foot. Okay, so you can see we do have a little bit of weakness when I was trying to get you to raise up onto your tiptoes and things like that in the foot. So we're going to try and strengthen all these muscles to try and help support the foot better. Okay, because now we're relying on that one structure, which is this plantar fascia, and underneath the ball of the big toe there's also quite a lot of pressure, right? So what I'm looking at is this red line that you can see on either side. Okay, and that red line represents the way the pressure is being distributed throughout the gait cycle. Okay, meaning obviously starting in the heel, going all the way on the inside of the foot, underneath the big toe, and then out the big toe. Okay, so if you look at this side, on the right foot, it's a little bit different. Okay, so it goes underneath straight into the big toe, but then it's also being distributed a little bit on the side and then out the big toe. Okay, and if you watch what I mean, okay, so if you start here, right, if you see all the pressure in that heel goes straight underneath the ball of the big toe and then out. See red, then red there, then red out. Okay, so now if you watch this side, red, and then red distributed more evenly throughout the whole foot. Okay, whereas this side, it's, you know, much more on the inside and directly in that straight line. It's not being evenly distributed. Ideally what I want to see is, so if you look at this, on a normal foot posture, what we would like to see is this red line being a gradual S curve going around the foot and up, right? Not straight from the heel underneath the big toe. Okay, because if you have to picture this, okay, so if you take my let me get this out your way, and then I want you to have a seat here. Without your shoes. The same leg. So sometimes you might have one leg that's slightly longer, which is why sometimes one leg hurts, not the other, because one takes a little bit more pressure. Then get you to stand for me. Okay, so I'm just going to slow it down a little bit. So what I'm looking at firstly is the angle of the foot. Okay, so you can see how it's bent inward. Okay, so even this side bent inward. Ideally I want it to be nice and straight. Okay, and you can see how this, both your feet are sort of doing the same thing, right? And that is why we see this line coming in on the pressure, because the way the foot is now angled is causing that pressure line to occur, right? And then the other thing that I'm looking at is pretty fine, where you have one toe on this side, one toe on that side, and not, you know, multiple toes facing on either side. Okay, because that would give me an indication of a lot of abduction that's occurring, that yours is relatively fine. So sometimes you can see the big toe on this side and the small toe on that side, which means your foot is going in a relatively straight line, which is a good thing, right? But what I want you to see over here is what's happening to this arch when you are walking, right? So you can see when you are non-weight bearing, you have a little bit of an arch. Okay, so this is how we want our foot to look, right? But as you go through your gait cycle, you see what's happening to this area. It's collapsing, it's going all the way down, right? And with that, again, Okay, so it goes into that rested position, so there's no tension anymore, right? So when you go to bed, you're not in any pain or anything of that sort, right? So the whole night the foot remains in that rested position and it gets used to being in that position again. But then what happens when you first put your foot down in the morning? So you see, throughout the day what is happening is in this area we build up a thing called substance P, right? Substance P, when it's released, it causes a pain stimulus, and it's usually found in, like, areas where there's inflammation and things like that. So what happens is when you now put your foot down in the morning, this plantar fascia stretches out instantly. It stretches, it pulls on the heel, and then it starts feeling like there's something sort of shooting and pressing in that area. But as you start to walk again, that plantar fascia starts to stretch out, it starts to ease, and the pain then starts to go.
Along the plantar fascia and the medial culnar area, the tenderness he noted was localized, a good sign indicating a mild inflammation rather than a deep-seated orthopedic issue. To confirm, he performed a few non-invasive tests, just to ascertain how serious or if there was any underlying, danger which was, in the heel. He also did a dorsiflexion resistance, heel raise, and positive stretching, without any imaging, because there was no need to do any imaging in that effect. Now, the condition was clinical and manageable through some conservative treatment, some icing, and some, mild painkillers. Now, Graig took a moment to explain the anatomy of the heel using a digital model, showing how the plantar fascia acts like a shock absorber under the footwork. After long hours of driving or working on hard surfaces, micro tears can form, leading to what medically refers to plantar fasciitis, often presenting a morning heel pain or discomfort after rest. His tone was reassuring, factual, but emphatic, to my word. He emphasized that with proper rest, footwear, adjustments and stretching, the pain would resolve naturally, hence the emphasis. He prescribed simple management plan. For example, the first one that he said that she was to have, adequate rest and avoid prolonged standing, gentle calf and plantar fascia stretches twice daily. The third one is ice massage after long drives, and then the last one, which is the fourth one, supportive footwear with cushioned heel pad. And he did say that for additional comfort, he demonstrated how to tape the arc to reduce some tension, a minor yet effective method in redistributing foot pressure. So, as we stepped out, yeah, we had some good, talk about, a lot of issues. But as we've stepped out, we couldn't help but appreciate the seamless professionalism of the Sandton medical community that he is part of. There was no rush, no coldness, just careful attention and a genuine sense of care. Monique's diagnosis turned out to be mild plantar irritation, nothing surgical, nothing alarming, no infection, just the body reminding us that even the smallest part deserves rest after a long adventure across South Africa. So, that was our day with the podiatrist, a reminder that wellness is not only about fitness or diet, but also about listening to your body, quieter signals. To Dr. Graig and his wonderful team, thank you for your time and hospitality. And to all our viewers, if you ever experience foot or heel pain, don't ignore. A quick visit to a podiatrist might save you from months of discomfort. Until next time, stay healthy, stay curious, and keep exploring.
Flatten out like this, and you can see
if you're reading this now, odds are I've already left town. A few cities in between, the new skyline where I'm looking down. A few empties on the floor and a note on the door of your house. And this silence reminds me of what's left behind me for now. There's a broken down car parked outside the barn up the road, and a weather vane hanging all crooked from the rain and the snow. I'm a half-mile past where we ran out of gas years ago. I'm taking my time and I'm gonna drive by it once more. But you'll see there's a new life waiting, and I just don't want this feeling to go. If you're reading this now, please remember the good times we had.